A warm welcome to everyone. I'm Dr. Shruti and this is Milo Live Session. Our topic for today is important things to know before conception, which is a part of preconceptional counseling. I'll be taking questions from you guys, but before that, let's talk a bit about why preconceptional counseling is so important. The fact is, once you conceive, the embryo starts developing at a very rapid pace. A small bundle of cells is already implanted into the lining of your uterus even before you miss your period and get to know that you are pregnant. Now, this small bundle of cells might seem very tiny, and in fact, it is actually very small. It is about the size of a small poppy seed. But the fact is that it has cells that are very rapidly dividing and are very sensitive to any kind of toxins or radiation that the mother's body might face. That is why anything that is avoided during pregnancy is also avoided during this crucial preconceptional time. I would also say that the first 3 months, that is the first 12 weeks of pregnancy, are also very important. Why? Because it is the time of organogenesis. It is the time when tiny organ systems are developing, and that is why most miscarriages and most birth defects also happen during this time only. That is why I always say that if you are suffering from any kind of pre-existing condition, like you might be having diabetes, hypertension, or heart diseases, SLE, epilepsy, any kind of condition, or you might even be facing some kind of infections, that in any kind of these scenarios, it is absolutely important that you inform your doctor that you plan on to become pregnant. What it does two things. First of all, it gives your body enough time to get rid of these infections and get these certain conditions under control so as to provide a safe and healthy environment to the growing fetus and baby. Secondly, it gives your doctor a chance, an opportunity to switch you to medicines which are more compatible with the pregnancy and are safer for the baby. Okay, and also, even if you think that you are absolutely fine and disease free, preconceptional counseling or care is still important for you. Why? Because many times what happens is that women might be feeling that they are feeling absolutely fine, they do not have any kind of diseases, and they go on to conceive. And once they conceive and become pregnant, they go on to visit the gynecologist, and during testing or those examinations, they get to know that they are actually suffering from some kind of viral illnesses which they did not know about before conceiving, or they might even be having some kind of pre-existing conditions like hypertension or diabetes, and they never had any symptoms, so they never got tested. So to prevent these, I would say always visit a gynecologist, get preconceptional counseling, get yourself tested, and also make sure that your vaccination status is also up to date, because there are certain vaccines which cannot be given during pregnancy. So it is always a good idea to get those vaccines before you plan on to conceive. What it does, it prevents your baby from certain viral illnesses which are easily preventable with vaccines. Secondly, I would say uh, stop alcohol and smoking at all. Any amount of alcohol or smoking is not safe. 0% is safe. Okay, and also limit your amount of caffeine, and also remember that cold drinks also have caffeine in them. Okay, then secondly, I would say eat a balanced healthy diet. Keep your BMI in a normal range. Low BMI and high BMI are associated with complicated pregnancy. Especially high BMI is associated with hypertension, diabetes, stillbirth, and even birth defects if you are too obese. Okay, and also it is not recommended to lose weight during pregnancy. That is why Before you plan on to conceive, lose a bit of weight, keep yourself into the BMI, normal BMI range, and then you conceive. Okay, and then also, yes. Next, I would say stop taking any high doses of vitamins that you might be taking for any kind of condition, especially vitamin A or retinol, because it is associated with birth defects. Your regular prenatal vitamins are not at very high doses, so they can be taken, especially folic acid. 400 micrograms of folic acid daily is recommended. It is very useful and it is very beneficial for the growing fetus and embryo, and it prevents birth defects, especially neural tube defects. Then I would say, what else is important? Exercise. Yes, 30 minutes of exercise every day for at least 5 days a week is recommended. Yoga and meditations are also very helpful. Then I would say get adequate sleep, and I know it is very difficult, but take as a less amount of stress as you can, because happy mothers make healthy babies. Now, it is time to move on to the questions. The first question that we have is, what should be the BMI if we are planning for a baby? Okay, the normal range according to Indian standards is 18.5 to 22.9. Anything less than 18.5 is comes into the category of underweight. And being underweight is associated with miscarriages, preterm labor, and premature rupture of membranes and all. Because the body needs certain amount of fat and BMI to sustain a pregnancy. Now, anything 23 or above is overweight, and 25 and above is obesity. The conditions and complications associated with high BMI we have already discussed. Now, moving on to the second question. Someone has asked, what preconceptional test should I get done? Not just lab test, I would say there are examinations also, a general physical examination, and then there is a gynecological examination to rule out certain major diseases that you might be already having. And then tests are there, the urine test and blood test. Blood tests are also done to rule out torch infections and other viral infections like HIV, hepatitis B, hepatitis C, syphilis, or any other kind of diseases. Okay, then there is a baseline CBC, or your gynecologist might also order a TSH depending on your history or the area that you're living. And also thalassemia screening is very important in our country. Moving on to the next question. I am suffering from PCOS for last 3 years, and we are trying for last 6 months. What to do? Okay, I would say in this case that you should visit a infertility specialist. Why? Because normally in when everything is fine, we give a time of 1 year to conceive naturally, and even after if 1 year of trying, consistently trying, you are not able to conceive naturally, then you go for infertility treatment. But if you are above 35 years of age, or if you are having already a pre-existing condition which is associated with infertility, like in this case you are having PCOS is already known to have a problem in conceiving, so that is why 6 months are enough in these cases. So if it has already been 6 months, visit an infertility specialist. Moving on to the next question. कंसीव करने का बेस्ट टाइम क्या होता है? आई थिंक ये इस क्वेश्चन में पूछना चाह रहे हैं कि कंसीव करने के सबसे ज़्यादा चांसेस कब होते हैं. कंसीव करने के सबसे ज़्यादा चांसेस देखने के लिए आपको अपनी साइकिल ट्रैक करनी पड़ेगी. आजकल बहुत सारी ऐप्स हैं, माइलो में भी ये फीचर आपको मिल जाएगा आप ट्रैक करने का, आई थिंक. और आपका जो बेसिकली फर्स्ट डे होता है पीरियड का, वो आपका होता है डे 1. आप ऐसे डे 2, डे 3 एंड डे 4 काउंट करते रहिए, एंड ऐसे आपको पता चलेगा कि आपकी कितने दिन की एग्जैक्टली साइकिल है. 25 डेज़ की भी हो सकती है, 35 डेज़ की भी हो सकती है. जितने भी दिन की है रेगुलर होनी चाहिए बेसिकली, ठीक है। और इस साइकिल के डे 8 यानी कि 8वें दिन से 19वें दिन तक, डे 8 टू डे 19 आपका मोस्ट फर्टाइल पीरियड होता है। ऑब्वियसली इसके अलावा भी आप कंसीव कर सकते हैं, लेकिन सबसे ज़्यादा चांसेस कंसीव करने के इसी दौरान होते हैं, डे 8 टू डे 19 के बीच में। मूविंग ऑन टू द नेक्स्ट क्वेश्चन, is there any specific position in which conceiving a baby is easier, or is it just a myth? Yes, definitely. It is definitely a myth. Because if you're having vaginal intercourse, no matter what the position is, the after just within a few minutes after ejaculation, the sperm crosses the cervical mucus and enters into the uterine cavity. So the position really doesn't matter. The result would be the same in case of vaginal intercourse. And I would say the timing is more important than position. Okay, now moving on to the next question. Till what age a woman can conceive a baby, or what is the accurate age when a woman should conceive? They are two questions actually. First, they have asked till what age a woman can conceive. The reality is, if you have not achieved menopause, no matter if you are 30 or 40 or 45, if you have not achieved menopause, you can conceive. The chances at increased age is definitely less, but you have the potential to conceive if you have not attained menopause. Now the second question is, what is the accurate age when a woman should conceive? I would say that I think a couple should conceive when they are at a stable position, not just physically, mentally, and socially, and financially also. That would be a good time. That being said, conceiving is easier when in your 20s. When you are in your 20s, it is very easy to conceive. And fertility definitely decreases with age, but the cutoff is 35. So if you are feeling that the 20s is very young to conceive, for some of you it might seem that 20s is very young to conceive, so don't worry, the cutoff we take is 35. After 35, the rate at which the fertility declines is even on the slope is a rapid one. Okay, the chances decreases very fast after 35, and after 40 it increases. The chances of conceiving decreases even faster. So even with treatment, chances of conceiving after 40 are very less. Not just the fertility decreases after 35. Even certain conditions are associated with increased age, like Down syndrome, and certain chromosomal abnormalities are associated with increased maternal age. So the cutoff is 35. Okay, now moving on to the next question. My cycles are regular but stays for 2 days. Why is it so? You don't really need to worry about it. Okay, because according to ASRM, 2 to 7 days of periods is normal. Some women might have 5 days of periods, some have 7 days, and some even bleed for 2 days. Bleeding for 2 days is not abnormal. Okay, it comes into the normal range only. There are many women who bleed for 2 days or 3 days only, and they go on to conceive naturally. They have pregnancy 1, 2, and 3 pregnancy naturally, and they never need to seek medical help for that. So if you are young, especially younger than 35, and just try on to conceive. Go give yourself a year if you're not having any kind of associated condition which is known to cause infertility. So and if you are still not able to conceive after 1 year, then seek infertility treatment. Having a period for 2 days in by itself is not really a problem. Okay, many women have conceived, so you don't really need to worry about it. Now that was all the questions that we had till now. It was really nice to interact with all of you, and thank you for having me, and all the best till next time. Thank you.